most vulnerable Americans, the industry agreed. Those were the right things to do for their consumers, their customers, the American people. And I applaud industry for that. And we're going to hold industry to that standard, a standard in which industry can still thrive, but Americans are getting a fair shake. The Patient's Bill of Rights also eliminates the barriers that stand between the American people and their doctors. Americans will be able to keep the primary care doctor or pediatrician they choose. You'll be able to see an OBGYN without a referral. You'll be able to seek emergency care at a hospital outside the plan's network without fighting to get approval from an insurance company first. And consumers will finally have access to simple, clear information about their choices and their rights. These protections to preserve America's choice of doctors made up the original Patient's Bill of Rights. It was a proposal that was debated over a decade ago with significant bipartisan support, but was never enacted until now as part of the Affordable Care Act. So this is a long overdue victory for America's consumers and patients. And yes, it does away with the status quo that some insurance companies have taken advantage of for so long, but insurance companies should see this reform as an opportunity to improve care and increase competition. They shouldn't see it as an opportunity to enact unjustifiable rate increases that don't boost care and inflate their bottom line. And the fact is, some insurance companies tried to raise rates even before we passed the law, even though some of them were making record profits. Earlier this year, for example, more than 800,000 Anthem Blue Cross customers in California opened their mail to see that their premiums would go up by as much as 39%. And my administration wanted to know why. People's wages aren't going up 39%. And the company's expenses didn't rise by 39%. And when pressed, they took a look at it and said, well, our math is wrong. We didn't justify that kind of rate increase, so they withdrew it. The point is that there are genuine cost drivers that are not caused by insurance companies. But what is also true is we've got to make sure that this new law is not being used as an excuse to simply drive up costs. So what we do is make sure that the Affordable Care Act gives us new tools to promote competition, transparency, and better deals for consumers. The CEOs here today need to know that they're going to be required to publicly justify unreasonable premium increases on your websites, as well as the law's new website, healthcare.gov. As we set up the exchanges, we'll be watching closely and will fully support states if they exercise their review authority to keep excessively expensive plans out of their insurance exchanges. None of this is designed to deprive insurance companies of their fair rates. And as I mentioned when we were meeting with the CEOs, there are a lot of cost drivers other than those that are within insurance companies' control. But it is important to have these steps in place to protect consumers from unjustifiable rate increases. In fact, many states are already exercising their review authority. We're already seeing a wave of change that's lifting up consumers and leveling the playing field. Maine rejected a proposed 18% rate hike there. Pennsylvania is investigating premium increases made by 9 of the state's largest insurers. New York recently passed a law granting the state the authority to review and approve premium increases before they take effect. And we're working with other states and the state insurance commissioners here today to support similar efforts. Secretary Sebelius has urged them to investigate other rate hikes. We've set up a new Office of Consumer Information and Insurance Oversight to help. And we'll provide grants to the states that run the best, most innovative oversight programs to protect their consumers. And beginning next year, insurance companies will be required to spend at least 80 or 85% of healthcare dollars where they should be spent, on healthcare and on efforts to improve its quality. Not on profits, not on bonuses, not on administrative costs that don't make people healthier. Ultimately, all these reforms are about more than just ending a dangerous status quo. They're about offering stability and security to Americans who need it. Now, we're in Washington, so obviously there's politics involved. And I've got some folks on the other side of the aisle that still think none of this should happen. And, in fact, have said they're going to run on a platform of repeal. They want to go back to the system we had before. Would you? Would you want to go back to discriminating against children with pre-existing conditions? Would you want to go back to dropping coverage for people when they get sick? Would you want to reinstate lifetime limits on benefits so that mothers like Amy have to worry? We're not going back. I refuse to go back, and so do countless Americans who bravely shared their stories with me over 2 years as I traveled this country, and who wrote letter after letter to me in the White House. A lot of them are here today. You heard Amy's story. Taylor got ill, and the treatment produced multiple costly side effects. And now, just 3 years after diagnosis, they're picking and choosing which tests and treatments to pursue because they don't want to exceed their plan's lifetime limits. So, Amy, you and Taylor are why the Affordable Care Act bans those lifetime limits. And you're why these members of Congress right here fought so hard, despite some very tough politics, to make this happen. I met Nathan Wilkes from Inglewood, Colorado, last August. His son, Thomas, was born with hemophilia in 2003. At the time, the Wilkes family had high-quality insurance through the high-tech company that Nathan helped to found. But when that insurer saw Thomas's claims, it began jacking up premiums for all of Nathan's employees and their families. No other insurer would take Nathan as long as Thomas was on the policy. Get out of here. You've seen me grab one of those before. So, as Nathan's family neared their lifetime limit, a social worker actually suggested that Nathan and his wife get divorced so that she could go on Medicaid. And nobody should face a choice like that in America. So, Nathan, you and your family, you're why the Affordable Care Act bans those lifetime limits and ends the discrimination that young Thomas faced. I met Laura Kliska last year in Green Bay, Wisconsin. Laura, it's wonderful to see her here with her crew. Laura was diagnosed with breast cancer 2 years ago. She's undergone 8 rounds of chemotherapy, a double mastectomy, 33 rounds of radiation. Then the cancer returned, spread to her bones. She lost her job during treatment. The coverage she had through her husband's employer has a lifetime limit of $1 million. And so, like Nathan, they worry they'll hit that limit. They're struggling to pay their medical bills. Laura's worried about losing their house. She just wants to make sure that she can spend time focused on being well and not worrying about her medical bills. Laura, you're why we banned those lifetime limits too. I met Katie Gibson last year in Bozeman, Montana. Because Katie once had cancer, her insurance policy was suddenly revoked when she needed it most, even though she was paying her premiums. I called Katie the day after the House passed a reform bill last November. And I told her then that when it finally became law, we'd be able to protect Americans like her from the kind of abuses she's had to endure. And Katie, now we can't. So anybody who favors repeal is welcome to come talk to these people and tell them why we should go back to the status quo prior to us signing this bill. Go back to the way things were. They are going to need to explain why they and tens of millions of Americans should have their new rights taken away. I don't think they'll have that conversation. Because in the end, folks like Amy and Nathan and Laura and Katie are who this law was made to help. Americans who work hard, who do the right thing, and just expect a fair shake in return.